Hi, I'm Megan Schmidt with the Holland Sentinel. I'm here with Dwayne Rotman. He's a senior instructor for the American Red Cross, and he's going to demonstrate for us today how to perform CPR.
Every 2 minutes, someone in the United States has a sudden cardiac arrest. That is a heart attack, they're down, they're out. Now what's going to happen? It might be a neighbor, it might be somebody on the street, it might be a family member. When you come in for a CPR class, you'll receive the book, and in this case it's listed as CPR First Aid AED, the Automatic External Defibrillator, which is here, and that is also taught in the CPR class. We get into first aid, we get into sudden illness. That's your book, that you take along, and that's going to be your guide. This is the adult CPR card, and in the card lists everything that you have to know about doing CPR and with the AED. So this card goes along with you. Now this can be your medical background as you're going along. Now, adult CPR changed a couple of years ago, and we instituted, I think, last August, or a year ago last August. It used to be a dozen compressions and 2 breaths. And what they found out, in order to supplement the oxygen in the body, now we're doing 30 compressions and a couple of breaths. Now, what they're looking at, and what you have to look at when you're doing CPR on an adult, now this is on an adult, what I like to do, is get the area exposed, the chest area exposed. You've checked your victim, you know your victim's not breathing because you look, listen, and feel for breath. You check the artery on the side of the neck. You know that there's no pulse. You're going to start your CPR, and basically your CPR is finding your sternum. Your sternum is a major bone that runs right down the chest, right down the middle of the chest. You're going to put the palm of your hand on the sternum. You're going to interlock your fingers over the top. Now on an adult, we're going to do direct pressure straight down, locking in the elbows, approximately 2 inches. Now this has to be done at approximately 100 beats a minute. So you're moving right along. After the completion of 30 compressions, you're going to tip the head back and you're going to give 2 breaths. And you say, well, I'm not sure about giving 2 breaths. Well, here our mannequins are all sanitized, and what you're going to receive here is a shield, and this is a face shield, and you can see the diagram of the face on the shield. What you'll end up doing is putting that face shield over the victim, whether a friend, someone on the street, or family member. Pinch the nose and give 2 breaths. Once the breaths are in, you see the chest rise. You're going to come back up, get on the sternum again, and 30 more compressions at 100 beats a minute. All right? Now basically this is CPR for an adult. The thing of it is that, yeah, you can pick this up off the video, but what you need to do is come in and actually get your hands on a victim, because there's a number of things that we talk about before we actually get to this point. How do you recognize a sudden illness or a heart attack? There's signs and symptoms of a heart attack. I know 3 people that did not have to have CPR because a heart attack was recognized and they were taken to the hospital. It didn't get to a point where the heart actually stopped. All right, so that is extremely important. There's 4 phases that in the cardiac arrest that we'll talk about. And one's quick call. Get that 911 call in. The other is early CPR. The other thing is early defibrillation with an AED. And the 4th item is advanced medical support, i.e. the paramedics and getting the victim to the hospital. Now that will take care of your adult as far as the CPR goes. We'll also talk about bloodborne pathogens in the class. What constitutes a bloodborne pathogen? What constitute body fluids? And we're going to discuss this, and it's all part of the class. Let's take a look at the AED. You've probably seen these things. They're talking them up all over the country, and they do save lives. Now an AED, automatic external defibrillator, are in most schools now. Many businesses have them. Airports have them. And basically, we have trainers here, but in the next room we also have a real one on the wall ready for use. The AED is extremely easy to start out with. You can see the pull handle on top. You pull this down, it's voice activated. The AED voice activation will actually walk you through all the procedures. Where to place the pads, when to touch the patient, when not to touch the patient. There are certain electrical systems in the body, and there's 2 of them where the AED will react. And if this AED does not pick up one of those 2 electrical systems, electrical faults in the heart, it won't activate it. It will tell you to do CPR. If it picks up 1 or 2, it will tell you to not touch the patient and shock. A light will come on, you hit the shock button, and it'll automatically shock the patient. Once the patient's shocked, it will still talk you through CPR. It'll talk you through when to give the breath. And that's all part of the AED. Here again, you cannot shock someone that has a heartbeat. The AED will not allow you to do it. So very safe. Here again, at the CPR class, we get into detail on this, and we actually use the practice AEDs. Child and infant, CPR. I had a good friend of mine that took an adult CPR class, and about 2 weeks after that happened, his grandson fell in a pond in front of his house. He had really not taken the child and infant CPR, but he knew enough about it from the instructor in class that when they got his grandson out of the pond, he started CPR. Did he do everything right? I don't think so. Right compressions, right breathing, probably not, all the excitement. But you know something, his grandson is alive and walking today because he knew how to react. He knew what to do, he knew what to look for. And that's, again, the skill card for child and infant. And that's yours with the class to take home and post it on the door. Post it someplace. If you have a babysitter, we have a babysitter class, 11 to 15 years old, and they're taught this for child and infant. They're taught sudden illness for child and infant. It's knowledge that saves lives. All right? Here again, infant is completely different than the adult. Where the adult, I'll put the palm of my hand on the sternum and 2-inch compressions. 2 inches goes down a long ways. What we're doing is pinching the heart between the sternum and the backbone and making the blood move. With a child or infant, instead of the palm of your hand, because they are delicate, we'll use a couple of fingers and we'll set it right on that breastbone, and then we'll do our compressions approximately 1/2 inch. Again, it'll be on a hard surface, not me holding it, but it's going to be about 100 strokes a minute and 30 of them. And then we'll take a look at the infant. Is the infant breathing? Do we have a heartbeat? If not, we'll do some rescue breaths and we'll continue on until advanced life support gets there or the infant is revived. So here again, CPR for the adult is one thing. CPR for child and infant is something totally different. And during class, you'll get hands-on with the adult mannequin. You'll get hands-on with the child and infant.
How extensive is the CPR training?
Well, what we've done here took what, about 2 to 3 minutes basically. And it was just an overview. On the adult CPR, AED is very easy to spend 4 hours. Now, in that CPR class, you're also going to learn about choking. You're going to learn about conscious choking. You're going to learn about unconscious choking. And it's quite encompassing. And the biggest thing is learning to recognize what a heart attack is. And that 4-cycle cardiac chain of events is extremely important. So here again, between the adult CPR, the AED, it is about a 4-hour class, and there's plenty of hands-on practice so you understand what you're doing and why you're doing it.
Okay, great. Well, if you want more information or want to sign up for a class, contact the Ottawa County Red Cross. For the Holland Sentinel, I'm Megan Schmidt.